Hi, I'm Dr. Cody Gordon. I'm the owner at Align Health and Wellness. We're an Upper Cervical Chiropractic Center located here in Calgary, Alberta. Today we're going to talk about TMJ, or dysfunction in the temporomandibular joint, and how upper cervical chiropractic can impact and help a person potentially recover from dysfunction in that area. Upper cervical chiropractic takes into account the balance of the head on top of the first vertebra in the neck and the balance of that first vertebra on top of the neck below. Misalignments in that area can cause stress in a number of ways, putting mechanical stress on the body and putting stress back onto the nervous system. Today we're going to talk about how that impacts the temporomandibular joint and how treating that area can give positive impact or restore balance in that TMJ and really help to bring out the symptoms or bring down the symptoms for an individual. The temporomandibular joint, where the mandible meets back up to the condyle of the skull, exists as a very unique joint in the body, such that all joints in your body have a joint capsule. That joint capsule holds two bones together. So as they come together, the capsule holds them together, and muscles traverse over those bones, and the bones can move through certain ranges of motion allowed by that joint capsule. The temporomandibular joint does not have a joint capsule. It's the only joint in the human body that doesn't have a joint capsule, because your jaw needs to not only hinge open, it needs to also translate forward. So you don't open and close your jaw like Pac-Man. You open and you translate. A joint capsule would prevent that translation, and so we can't have one there. So instead, we have a series of muscular slings, so muscles of mastication that act as slings that hold your mandible onto your maxilla, or the top of the base of the skull. That muscular sling allows for that jaw to move from side to side a little bit. And those muscles need to be greatly coordinated to allow your teeth to open and close, to allow you to chew and to talk, and to have dexterity in your mouth, such that you can do those things without biting your tongue off. Now, if you have a misalignment at the top of the neck, the atlas vertebra that sits really just below your ear, it also has a great amount of range of motion as far as vertebrae in the spine are considered. If that vertebra slips out of place, causing the head to tilt a little bit to one side and the neck to lean away to compensate for that, we're going to get a distortion in the posture, and you're going to get some wear and joints in the body moving in ways that they're not supposed to. But you're also going to get that muscular sling holding that mandible, allowing it to slide to one side as the head is tipped over, one way or the other. What will happen in that case is we'll develop a prematurity, early contact on one side. Your body then will compensate by tightening up the muscles on the other side so that your teeth then meet a little bit more evenly. The problem that we have there is now increased muscle tension over a long period of time is jarring that TMJ joint or jamming the joint back up into the condyle. We can experience things like pain, reduced range of opening. Clicking is very common. Often people will have clicking before they develop pain. And a lot of the time people are mystified by these problems because they have pain in the jaw, dysfunction in the jaw, and they've had no previous history of trauma to the jaw. Whereas the trauma or the insult was actually to the neck, and the neck has a great relationship to how your jaw can actually function. What I'll then do with a patient presenting like that, following an exam, we'll shoot a series of x-rays around the head and the neck and map out exactly how that upper cervical joint complex is supporting the skull, and we'll provide a very, very gentle but specific adjustment to the upper neck, designed to restore the balance of the head on top of the neck and the first vertebra that sits below the skull. When we've restored that balance and we work at developing some stability with that patient, the hope is that the muscles in that TMJ are going to settle out. They're going to start to relax and allow the movement of the mandible through a normal path of closure and contact with the teeth. That, in a nutshell, is how Upper Cervical Chiropractic addresses dysfunctions of the TMJ. To learn more about Upper Cervical Chiropractic, please visit our website, alignhealthandwellness.com, and enjoy some of the other videos and content there. Thanks for listening. See you soon.